Today, we're going to start by hearing from Dr. Ed Shao, who is with the University of California, San Francisco. He's going to talk to you about things we're learning from the FOP registry. And then our FOP registry manager, Sammy Kyle, will talk to you about how you join the registry and be a part of this important research. If you were in our session yesterday on clinical trials, we did a lot of talking about the importance of the registry and the data that's shared from that. And then also today with us is Dr. Dan Perrin from Emory University, who manages the FOP Biobank. And he's going to share with you that as a resource that is currently available to US families. So you'll learn a little bit more about how to participate in the biobank and why it's important. And then the IFOPA's research director, Dr. Danielle Kirkovic, will be here to share with you about clinical studies and trials and some of the resources that are available to you. So with that, I am going to turn it over to Dr. Ed Shao.
Hi, thank you very much for this opportunity to talk to you a little bit about the FOP registry, because this is actually a critical resource and we want to make sure that you understand all of your contributions as well as what it means to actually have access to this data from a research standpoint. So the FOP registry was created to add patients' voices to every facet of FOP research and to really facilitate and speed up aspects of FOP research towards a series of better treatments as well as day-to-day management for patients with FOP. I want to emphasize that it's really your story and your data that really helps tell us about what is going on about the FOP journey. The registry is a patient-driven resource. This means that data in the FOP registry is reported primarily by patients. The FOP community is united in the belief that no one is as passionate as the patients and their families for really wanting to find new treatments and a cure. And really, it's the patients that have the best ability to describe what is going on in terms of their symptoms and quality of life issues. The IFOPA registry participants represent an important voice for the FOP community. They provide ways to engage in research through patient surveys, joining clinical trials, advocating by expressing unmet needs, and tracking the effectiveness of new trial drugs, and helping to speed up drug approval processes. So, to give you a sense of how your data is actually being used, wanted to go through a couple of examples. But what's important is that researchers that want to use the FOP registry material, they have to go through the FOP registry medical advisory board. They can request access to the registry data for their research studies, and this data is provided in a de-identified and aggregated analysis, meaning that there is no one specific piece of a patient's data that is ever conveyed. It's only conveyed as a combined analysis. This helps to prevent de-identification. This means that basically anybody who is accessing the data, um, they can't identify who the individual person is that is identifying that is providing the data. And this means that you, as a participant, are always in charge of your data, and you can have your data removed from the registry at any time just by contacting the registry staff. Why is the FOP registry so important? It allows us to better understand what is going on in FOP and to accelerate the development and availability of disease modifying treatments and possibly a cure in the future. Learnings from the FOP registry help the patients, caregivers, and physicians to understand what are the ongoing issues in FOP and to help come up with better management strategies for patients with FOP. And the information that is collected helps clinicians and researchers understand FOP better so that we can better guide how the research is actually going to be conducted, as well as really start telling other groups how important it is to address a particular question. So, what we collect in the registry is actually a couple of different components. The first one is diagnosis information, and we'll talk a little bit about how that has actually helped us understand what the diagnostic journey has been for patients with FOP. We also want to know about the impact of FOP on different body systems, as well as the impact of FOP on quality of life. We're also very interested in understanding the amount of extra bone growth that is occurring, and also the ongoing care and treatment, as well as aspects of care and treatment that you think might need to be expanded or better addressed. So, to give you a sense of what we're seeing, these are some samples of the analysis of the FOP registry data. So, for example, what we can see is that 45% of people actually have reported that they have symptoms that affect their ears or their hearing, as well as 34% of people with FOP have reported some type of skin problems. And 28% of people have difficulty with breathing and stomach and digestion issues, as well as challenges with sleeping. And so, as you can see, these are things that we kind of know about that are occurring in the FOP community. But oftentimes we get questions like, is this just me, or or do other people have concerns about these types of symptoms? And so the FOP registry has allowed us to really start to say, yes, this is actually part of the spectrum of the FOP disease presentation. In addition, we can take a look at the diagnostic journey. And I think this is one aspect that has been really intriguing because looking at the data since 2016, there's been a 32% decrease in the time that it takes to diagnose FOP. And what you can see here is that the mean age of diagnosis has gone down over time. Um, the non-classical mutations still do take a little bit of time, but as you can see with all of the different FOP mutations, the mean age of diagnosis is now about 8 years old. The mean time from symptom onset to diagnosis has also gone down. Um, Meaning that it was about a little over 2 years prior to 2016. And then since 2016, it's now about 1.5 years. So unfortunately, it still does take a long time to diagnose FOP, but this is definitely signs of significant improvement and much better awareness by the medical community about FOP. And we hope to continue to push this diagnostic time even shorter. So as you can see here, this slide was useful for us because what you can see is that what are the specialties that are helping with the the accurate diagnosis of FOP. As you can see, that there are many, many different types of physicians that are involved, but making sure that we target groups like orthopedists and pediatricians really to help make sure that they are very aware of FOP is really valuable. And so this has been something that we've been trying to do through different strategies and outreach. But in addition to that, what we've also realized is that there are many common misdiagnoses in FOP. And the biggest one is cancer. And this is important because in patients who have been diagnosed with cancer, they may get additional procedures. And in patients with FOP, those additional procedures may lead to significant consequences. And so for us, it's very important to be able to educate the clinicians that if you see a patient with the classical signs of FOP, as well as a potential diagnosis of cancer, you really need to think carefully about the next steps to make sure that you don't aggravate the FOP. So there are a couple of other projects that have used the registry. So one of them is actually looking at the effects of COVID on patients with FOP. And this includes a series of questionnaires looking at aspects of clinical care and clinical care access that were impacted by the COVID-19 pandemic. Sorry, it's COVID-19, not COVID-10 here. Um, and this is now published, but what you can see is that patients with FOP did have a significant decrease in the number of visits that they had to their dentists as well as their healthcare providers. And we're hoping that as the pandemic stabilizes and as things get better, particularly with telehealth, availability of telehealth, um, that these numbers will actually improve and return back towards normal. And just as a separate aside, what we do want to emphasize is that although the COVID-19 pandemic has decreased the number of patient visits to providers, it is still important to make sure that you go and see your provider if you have any types of symptoms or any types of medical complications from the FOP, because we want to make sure that you get the care as soon as possible. The other study that I wanted to highlight is actually a project that was looking at neuropathic pain. So, for many patients with FOP, you know that there are aspects of pain or abnormal sensation that occurs. Um, as a set of different studies have been conducted, um, we've been able to use information from the registry to really document that a significant portion of patients, about 14% of patients, self report that they have some aspect of neuropathic pain or abnormal pain as a result of their FOP. And this was a study that was done by Dr. Yu, who actually was also able to do quantitative sensory testing as a result of this data from the registry to go and validate that the neuropathic pain was actually present in using a objective method of assessing for pain, and then also using human stem cells as a way of demonstrating what was the mechanism behind that pain. And so this again was basically a study that was driven by data provided by you in the registry that really validated that this was an important topic to try to understand. And so the hope is that this can now be extended into other strategies for treating pain, particularly in patients with FOP. So, what I want to emphasize is that being part of the registry really advances our knowledge of FOP. Through the FOP registry, we've already started to expand our understanding of the effects of COVID-19 and FOP, caregiver support, the diagnostic journey, symptoms of FOP, aspects of pain in FOP, and really understanding the HO progression and impact on joint mobility. What I want to do is to really encourage you to participate in the registry. This is an important resource for um, the community, not only so that you can see what other patients with FOP are going through, but also to drive the research and the clinical care for patients with FOP. The registry has already played a very important role in helping to understand the clinical outcomes in FOP. And this knowledge is critical for improving the design and conduct of clinical trials as we move forward. The FOP registry can also empower the FOP patient community to really directly contribute to research. So even if you're not comfortable or you don't want to participate in a clinical trial, this is a way to really contribute to the knowledge base to really understand what is going on in FOP. The FOP registry is well on its way to helping the FOP community to achieve these ambitious and urgent goals, and we hope that you will participate in this. So, if you would like more information about the registry, please go look at the IFOPA website. It's listed here. And if you are a healthcare provider and you're interested in the registry, please also reach out to the IFOPA, and that web link is also listed here for healthcare providers. All right, thank you. And so I will pass this back to Sammy.
Wonderful. Thank you so much, Ed, for really demonstrating just how important the FOP registry is to the entire FOP community and the valuable insights we have been able to make just by members of our community contributing their information. So now that we have covered the value gained from participation, I will quickly cover how to enroll and participate, as well as some other great features of the registry, and show you a pretty great video we developed last year on registry participation. So as Ed already covered the insightful information we have uncovered through data contributed to the FOP registry on the journey, I just wanted to reiterate the importance of participating and why it is important to consider participating if you're not already. Not only are we able to build to our current knowledge of the FOP journey, but through this knowledge gained, we are also able to accelerate clinical trials by informing trial design that tests medications to treat FOP and possibly find a cure. And we can help other patients and families better understand the disease and how it affects their lives. And we can also improve the care FOP patients receive from their physicians. The FOP registry was launched in 2015 and is now collecting over 7.5 years worth of data. This longitudinal data has really enabled us to track FOP patients' health over time and provide valuable insights.
We now have over 390 patients in the FOP registry from over 69 countries. And we also have a medical portal, which was launched in 2019, where FOP physicians can contribute information about their FOP patients into the registry as well. We currently have sites from Mexico, Argentina, Brazil, Australia, and the United States, and are continuing to add sites globally. Information on FOP patients is currently being entered, and the value of this is that the data from the physicians can also be linked to the data patients enter from the patient portal, providing a comprehensive view of the FOP patient's journey. Okay, so getting started, if you're not already enrolled, it's very easy to do. All it takes is a good internet connection, a computer or mobile device, and about 30 minutes to 1 hour of your time. So you'll simply go to www.fopregistry.org and click on the Join Now button to begin creating your account online. You'll be guided through the account creation process, and once your account is created, you'll complete your enrollment survey. Once you complete your enrollment survey, that starts the clock, and every 6 months, you'll be asked to fill out a follow-up survey. And the FOP registry is now translated into 9 languages, as noted here. So English, French, German, Italian, Korean, Polish, Spanish, Russian, and Portuguese. And if you ever encounter any issues, you can always reach out to me or help@fopregistry.org. So what questions do we ask you in the registry? The enrollment survey takes the longest because you'll need to complete the informed consent form. And we do ask questions about the history of your FOP, and we do request for your FOP diagnosis report. This report can be emailed to me or uploaded into the enrollment survey itself, and is an important part of the FOP registry to ensure only those with FOP are providing their information. The other questions that are asked are similar to the follow-up surveys, and we ask questions about your medical care and your participation in a clinical trial, your quality of life, FOP signs and symptoms, any aids or assistive devices that you may use, and medications. The more surveys that you fill out, the more familiar you become with the surveys, and the quicker and easier they are to fill out. As a reminder, we have the FOP Registry gift card reward program, where you are eligible to receive a $25 gift card in eligible countries and regions for every survey that you complete. And finally, we have a very exciting update to share. The FOP Registry now is available through the Google Play Store to download on Android devices. So this was launched just this week, and as a way to help improve your experience within the registry so you can complete these surveys on the go or wherever you wish. The Android app is available in all languages of the FOP registry, and we hope you use it. The iOS or the Apple app was launched a couple of years ago, and that can also be downloaded through the App Store. Okay, and now we will show you our registry animation video to provide an overview of what registry participation looks like.
Meet Anna. She just completed her 6-month follow-up survey for the FOP registry. The FOP registry is the largest and most detailed database of information about FOP and those who are living with the condition. And when Anna completes these surveys every 6 months, her data is combined with other participants' data, which allows researchers to better understand how FOP progresses over time. But first, let's go back and see how she got started. Using her computer, Anna first created an account in the FOP registry by entering her name, email, date of birth, and her preferred language in the patient database. Then she received an email to finish creating her account and read and sign the informed consent form. This form explained the study, so Anna could make an educated decision about whether or not to participate. Then Anna completed her enrollment survey to tell the story of how and when she was diagnosed and how FOP has affected her. During this final step, she uploaded her medical record that shows she has been diagnosed with FOP. Overall, it only took Anna between 30 minutes to an hour to complete. And as a thank you, the next month she received a $25 Visa gift card. That brings us to today. This time, Anna completed the follow-up survey on her phone. Next time, she may use her tablet. It was much shorter and only took her 30 minutes. Sometimes, when she hasn't had much FOP activity in the last 6 months, she can complete it in 15 minutes. When Anna completes her follow-up survey every 6 months, the information she provides about her health and FOP helps researchers understand how the condition is advancing and impacting her life. Understanding the journey of people living with FOP helps researchers and doctors improve research and medical care. And if she isn't feeling up to it, her caregiver can assist by entering her responses. Every time she completes a 6-month follow-up survey, she receives another $25 Visa gift card. Participating in the FOP registry is an easy way for Anna to have her story included in research, and she doesn't even have to leave her home. It's low risk for Anna and high reward for FOP research. When Anna participates in the registry, she contributes to the knowledge about FOP. FOP is a very complicated condition, so the information provided by people living with the condition, like Anna, helps doctors better understand FOP and improve care. Information from the registry also helps academic and pharmaceutical researchers develop new drugs and design clinical studies that test medications that could treat FOP. When information in the registry is used for research, the details that identify each participant are removed. Then the information is analyzed. These findings from the registry can be published in reports and articles. When Anna and her family read these, they also have a better understanding of FOP and how it may impact her life. One thing Anna learned from the last FOP registry annual report is that about 1/3 of registry participants have a hearing loss, just like Anna. Now, her family knows that her hearing loss isn't unusual for people with FOP. Anna has friends with FOP from around the world, of all ages, who are also participating in the registry. Currently, the registry is available in multiple languages, not just in English. The registry also has a medical section for doctors caring for someone living with FOP to complete. When Anna visits her doctor, he sometimes asks her questions or performs routine FOP checkups and enters the information in the medical portal. Having two sides of the FOP story, the experience of people living with FOP and the reports from doctors, gives a more complete picture of the condition. Anna is proud to be a part of the registry. Sometimes when she completes a survey, she will connect with people in the FOP community through social media and encourage them to participate as well. She understands that her FOP journey is very important for research. She is making a difference in FOP. You can too. Start by going to FOPregistry.org and click Join Now. Or if you have more questions, email us at help@FOPregistry.org.
Thank you so much. We are glad to be able to share that video with you about the importance of the registry. Next up, we have Dr. Dan Perrin here, who's going to talk about yet another way you can contribute to the registry through the FOP Biobank.
Thanks, Michelle. I'm really happy to have this opportunity to speak to families and patients about the biobank that we started with the IFOPA in 2018 and share with you some of the progress we're making and hopefully recruit some of you to participate or to participate a second time. So, slides are not advancing. Okay, so first of all, I just want to say I don't have any financial conflict of interest. There's nothing that I have personally to gain from doing all of this. It is research that we're doing to try to help the FOP community and make your diseases easier to manage and treat. So first of all, what is a biobank? It's kind of a weird word. And what a biobank is simply a place where we can collect samples from all over the United States, from many patients, handle those, process them the same way, and deposit them so that then researchers from other places can access those and we can redistribute them. So in 2018, when we started this, what we had were a number of people and laboratories around the country and even around the world that were creating their own small collections. And it was recognized that it would really help if we could pool all of these collections together, have one centralized place. And so that's what we did. At the time I was at Vanderbilt. And so we've partnered with a biobank there at Vanderbilt University to house and store these samples. And we collect basically three types of samples. We collect blood samples, saliva, and urine. And those go to Vanderbilt where they're processed, divided up into smaller pieces, and can be stored and then redistributed back not only to labs that already had their own collections, but to labs anywhere in the United States and, in fact, anywhere in the world. So, why do we want to do this? So, one of the questions that has come up from patients and families is that they have a hard time understanding whether or not the symptoms they're having actually are a flare, whether or not they should take medication. So, one way to address this, sorry, so when you have an injury, people often wonder if they have a flare. And then when having a flare, people wonder whether or not it's going to make new bone or it's not. And we currently don't have any tools, as you know, for determining those things. And as medications come online, people want to know whether or not they can or should stop medications. As you know, all medications have side effects, so no one wants to take a medication unless they need to. So we wanted to endeavor to try to discover and maybe create a tool that would help you make those decisions. So, the way that you do that is by developing a test, or a bioassay is the fancy word that we like to use for it. And you're familiar with these. These types of tests are things like COVID-19 tests, pregnancy tests, or even glucometers that measure blood sugar for people who have diabetes. And what we're trying to do is develop a similar test for FOP. So we want to determine whether or not there are changes in things in your blood, saliva, or urine that indicate whether or not you have a flare, what stage of a flare you might be in, or whether or not that flare will make bone. And we do that by measuring things like hormones, proteins, fats, and sugars in the samples that are donated. As you might imagine, there are a lot of differences in all of these things from one person to the next that have nothing to do with FOP. So we need a lot of samples to sort through all that noise and potentially find an indicator or a series of indicators that tell us something about disease progression and help you make better decisions about your healthcare. So, we partnered with the Vanderbilt Cardiology Core Lab for Translational and Clinical Research. This is a group of people that started a very large biobank that contains tens of thousands of samples related to cardiology. They have nothing to do with FOP, but they're experts in how to handle and store samples securely and also redistribute those to researchers in a secure way. In fact, they have a new thing called a CAP accreditation. In fact, they were the first academic biobank, meaning a biobank at a university, to receive this prestigious College of American Pathologists accreditation for their biobank. And what that says is that they have established all the procedures and for processing, storing, redistributing, and keeping track of all the enormous amounts of information that come along with those samples. So the samples that we receive are going to one of the best places in the country to possibly handle these and help us make the most out of what's been donated. As I said, we started the biobank in 2018. In fact, we started it at the family gathering in 2018. And so we were able to collect samples there at the family gathering in 2019, and then COVID hit. Fortunately, we've collected um, samples from nearly 100 subjects. Um, these numbers are a little bit outdated. We're at about 45 FOP, 42 subjects or patients that have FOP have made donations, and about 53 subjects that do not have FOP that we refer to as controls. That is tremendous in the amount of patients in the FOP world, as you know. That's over 10% of the known subjects in the United States and Canada. That's actually really successful. But this is still a very small number of patients for the type of research that needs to be done to discover and develop these tests. But so far, we still have one research publication using these samples. It's in preparation. That's coming out of the University of Michigan that received samples about 2 years ago and have successfully used those to collect some data. And we're very excited to see what that publication has to say, hopefully within the year. As I said, one of the purposes of the biobank is to redistribute uh, these samples. Now, right now, we're limited to collecting samples from people in the United States, those who live in the United States, or if you are in another country and you visit the United States, we can collect a sample while you're here. Unfortunately, we can't ship samples from patients across borders. However, we are able to distribute samples back to researchers around the world. And so we're going to be enabling more research by more researchers worldwide. But we need your help to get this done. If you're interested in doing this, you can go to the IFOPA Biobank's website that you see here in green. You're also welcome to email me directly. As I said, all patients with FOP in the United States can donate. That's regardless of age. Patients who are younger require us to collect some additional information, but again, any patient can donate. We have certain major needs right now, particularly children without FOP, which may sound strange, but we need controls to make comparisons to. And I'll show you here. This is what the breakdown of our subjects that have made donors look like if we break it down by age here. And the height of these bars tell you the number of subjects at any given age range. So we have 8 subjects that were aged 24 to 29 that have FOP. In contrast, we have 1 subject in that same range, 25 to 30, that does not have FOP. So while we have tremendous participation, and we are very, very thankful to everyone who's donated of any age, we have this great participation among subjects with FOP. We need some control subjects who are willing to make donations. So one way that you can help is by perhaps contacting family members you know with young children and trying to persuade them to have their child participate and make donations. Particularly, we need blood samples. So that involves a blood draw, which is why many families who have young children are not too eager to put their kids into the study. But we really do need those. Secondly, we need patients who are having flares. Most of the samples that we've collected so far are from patients when they're not having a flare, which are very valuable. But what we really want to do is try to find something that indicates to us that the patient is having a flare. So we actually need samples that are collected during that process. And the most powerful samples that we can possibly get which were a major reason why we started this biobank, would be to collect samples from individuals throughout the course of a flare. We understand that this is a big ask, but these would be powerful samples. If we can have samples from the same patient before a flare and then collected at multiple time points during that flare, we can then see what those changes are that are specific to that patient in that flare period. And that is going to help us find these indicators of what your flare status is much, much faster. Most of these types of studies with other diseases would involve thousands of patients in order to find the molecules that allow them to make tests. We don't have that option, obviously. And that's why we need these repeat samples so desperately so that we can track things as those flares progress. So, how can you help? Well, as I said earlier, you can go to ifopa.org/biobank. There you'll find a lot of information on the biobank. You'll then need to complete a contact form and some consent forms that tell us that you understand what's going on, what information we're going to collect, and that you're okay with that. Unfortunately, they're long, so they can take up to 30 minutes to complete, depending on the age of the subject. You'll also indicate what samples you're interested in donating. And you can donate any combination of saliva, blood, urine. Also, if you have a small child who's about to lose their teeth, we can collect those teeth and actually get cells out of those. And that's done in partnership with Eileen Shore's laboratory. So please remember, because that is painless, if you have a child with FOP or a sibling that doesn't have FOP, please collect their teeth. Let us know ahead of time as soon as that tooth becomes loose, and we can collect those teeth and use those as well. You'll then have to complete a health history questionnaire. That one's fairly short, maybe 10 minutes, maybe less. And then we'll contact you to arrange shipment of a collection kit to your home. And that's going to contain everything that's needed. Even if you're doing a blood draw, it contains all the needles, syringes, and tubes, butterflies that a doctor or a nurse will use to collect your blood. If you're only giving saliva and urine, you can donate that, collect that at your home. If you are donating blood, which is definitely the most powerful and the most needed samples, you'll need to schedule a blood draw either with your physician or a nurse, perhaps someone to come to your house. Unfortunately, we don't currently have the funding to pay for that. So what a lot of subjects have done in donating from home is contacted us when they have an appointment for someone to come to their house or when they're going to see a physician. And there's going to be blood drawn anyway. It's very easy then for the physician or nurse to just simply collect more tubes. Once all the samples are collected, you'll place them in a provided cooler, apply a prepaid shipping label, and you can either call FedEx or drop them off at a FedEx facility. So all the supplies are provided. What you have to do is collect the samples. And again, we understand this is a time commitment from you all, and we really greatly appreciate it. But we do need your help. We need you to seriously consider participating and making these samples in order for us to hopefully develop these tests that will help guide your treatment. Lastly, before I close, I really want to thank anyone on here and everyone who has participated and given us samples. We are deeply, deeply grateful, and I assure you that we're doing our best to make sure that these samples get utilized. We're just reaching the point where the biobank has enough samples that researchers are becoming interested in getting them, feeling like we have enough that they can actually get some good data out of them. So again, we need to keep collecting those samples. And if you've donated already, please consider donating again. Or getting in touch with us about coordinating multiple donations during a flare. So I just want to acknowledge everyone that's involved. This is a big undertaking. The people at the biobank at Vanderbilt University really have donated their time. This is not something that they would have been involved in if I had not gone to them and asked them to do this. Yan Rusu and Kelsey Thomasek, they're the ones who manage the collection, storage, and redistribution of the samples. People in my lab have donated a lot of their time in going to family meetings and helping with collections, as well as Catherine DeHeer and Margot Black. Catherine DeHeer is an investigator in some of the clinical trials. Margot Black is her research nurse. And Margot has also donated her time coming to the family gatherings and collecting samples. And then, of course, this is all coordinated by the IFOPA. So thank you again so much for your time, for your participation, and please reach out to us. If you even are considering and you have questions, feel free to email me or just to contact us through the biobank website, and I'll be happy to talk to you about any questions and concerns you might have. Thank you very much.
Okay, thanks so much, Dan. That was really informative. I would just like now to cover how IFOPA is continuing to contribute to FOP research, which helps pharma and researchers understand the FOP journey. So I already spoke to the significance of the FOP registry, and Ed spoke to the power and the data that you can provide when you provide your data every 6 months. And we also have the ability to collect data through our FOP Prompt Daily Symptom Tracker, which helps us understand the longitudinal FOP journey on a daily basis. These are both examples of data that we collect and share with researchers that is quantitative or numeric in nature. But beyond that, we also help researchers understand FOP through your actual story, which is a more qualitative approach. And we do this by partnering with FOP researchers to conduct one-time or series of surveys on key topics of interest, patient advisory boards, and interviews where researchers and pharma hear directly from FOP patients what's important to you and how FOP greatly impacts you. And this is also captured through testimonies from the community. By building this robust information, researchers are better informed when determining clinical and research study design and approaches. So the provision of this type of information isn't necessarily new. The IFOPA has been supporting FOP researchers and pharma by helping and conducting these types of research opportunities for quite some time. You can see here, starting in 2016, we have been conducting patient panels, patient advisory boards, surveys, and helping with FDA advisory committees quite regularly, and we continue to do so. We believe there is power in hearing the FOP patient's voice, and we work with researchers to facilitate and conduct this research. So what does this mean for you? Just keep an eye out for opportunities to share your story. There is almost always something going on, and we share this through many of our outreach methods. So we encourage you to sign up for our e-newsletters if you haven't already, so you can receive the FOP community updates and the Connection e-newsletter. Just to continue looking at the support for FOP Facebook page, the IFOPA Facebook, Twitter, and Instagram pages, the other research page on the IFOPA website. And if you've joined the FOP registry, you'll also receive alerts that way. Okay, and now we are going to push it on over to Danielle.
Hi, everyone. My name's Danielle, and I'm excited to be here at this year's family gathering. I'm really excited to share with you information on clinical studies and trials, and I hope this will help you as you explore your choices. It's great to be able to say that, actually explore choices. Today, I'd like to share with you the difference between clinical studies and trials, why clinical trials have phases, understand why some trials include pediatrics and others do not, discuss factors to consider when deciding to enter a clinical trial, questions you may want to ask the investigator or research coordinator, and last, how to find clinical trials. The main differences between clinical studies and clinical trials can be summed up in 2 words: observation and intervention. Clinical studies look at how a disease like FOP behaves in the absence of any treatment. How does FOP affect how you feel or function at 10, 20, or 30 years old? How does FOP affect one's ability to live independently or pursue a career? Then there are clinical trials, in which one studies the effect an intervention such as a medication has on how FOP makes you feel or function. Is your stiffness or limited mobility the same, better, worse? How about FOP pain? Is it the same, better, or worse? Clinical trials where there is an intervention such as a medication have 4 different phases. So why is this? Generally speaking, each phase includes more patients, and we learn more about the effectiveness and safety of the medication as it passes through each phase. Phase 1 studies are conducted in a small number of healthy individuals and not those with FOP to assess safety of the medication and its potential side effects. This is done in healthy individuals because we want to separate side effects of the medication from symptoms associated with FOP. This is also an opportunity to determine the timing and concentration of medication needed to enter the bloodstream. In phase 2, we focus on the safety of the medication in patients with FOP and start to look at the drug's ability to treat FOP at that dose. Researchers are looking for signs the drug is effective short term. Phase 3 trials are designed to answer whether the drug is able to treat this disease. To do this, phase 3 trials may include a larger number of patients, a longer period of treatment, or both. Sometimes, especially in rare diseases such as FOP with fewer patients, you may see phases combined, such as a phase 2-3 trial. Pharmaceutical sponsors and regulatory agencies that govern clinical trials are working together to establish safety and efficacy of new medications for everyone. Phase 4 trials happen after a drug is approved. We want to know what it means to stay on a drug for a long period of time, so we do a lot of following up. Let's look at the phases of FOP drugs in development. Phase 1 trials in healthy human subjects have been completed for Daiichi Sankyo's antibody against the ALK2 receptor, Keros' kinase inhibitor, and BioCryst's kinase inhibitor. Phase 2 trials where safety is assessed in those with FOP, and we begin to look at potential efficacy. We have rapamycin in Japan, Incyte's kinase inhibitor, Ipsen's kinase inhibitor, and StopFOP at the University of Amsterdam, London, England, and Germany. Oops, sorry about that. Garetosmab and palovarotene are both in phase 3 trials where we're really looking at the efficacy of the medication, the potential efficacy. So we have trials, phases of development, and designs specific to the goal of each study. The first design, is a placebo-controlled trial design, and it's what most of us think of when we think of a trial. Half the participants get the drug, the other half receive a pill or other medication that looks like the real drug to tell us whether or not the drug works better by not taking the drug. Open labels are those where everyone in the study is taking study drug and there's no placebo group. So I want to take a moment to talk about the crossover design, the third kind of trial. In a crossover design, researchers often combine the 2 designs, placebo and open label, into a single trial. After entering the trial through a screening process, FOP participants are randomly assigned to either an intervention group taking the medication or the placebo group for the first part of the study, let's say maybe 6 months. For the remaining 12 months, everyone is on medication. This provides investigators with a glimpse into the effect of a placebo and gives everyone in the trial the opportunity to take the medication. And lastly, a rollover study. A rollover study design is also sometimes called an extension study. A rollover trial allows for patients participating in one trial, such as the palovarotene phase 2 MOVE trial to roll over into the phase 3 palovarotene PIV1 trial, so investigators can continue to measure and observe longer-term safety and longer-term efficacy. So we have placebo-controlled, open-label, crossover, and rollover trial designs. Should I be in a trial? This is a really important question to be asking yourselves. There's a lot to think about and to discuss with your family, friends, and physician when considering participating in a trial. It's a time commitment that can exclude you from participating in other trials. You cannot be in more than one trial at once. There may be extra testing like blood draws or whole body CT scans. Researchers have a reasonable expectation the drug will be effective, but because the drug has not been tested in individuals with FOP, we don't know for sure whether or not it will work. And there may be anticipated side effects that you're warned about, and there may be unanticipated side effects. This is, after all, the first time the drug's been tested in someone with FOP. On the plus side, participating in a trial can be empowering. You did not choose FOP, but you can choose your reaction to it. You may have access to an effective medication. Additional testing may be cumbersome, but it also means that you and your disease are being monitored closely. Participating in a trial for FOP can help you, but it can also help others. Trials must be conducted before any drug is approved. A note about children in clinical trials. The IFOPA has heard from several parents regarding their desire to prevent disability for their children through access to medications being tested in clinical trials, and have expressed their disappointment that many trials do not include young children. The reason for this is an abundance of caution. Children are not small adults. First, we want to measure safety and efficacy in adults and take that information into consideration for trials with adolescents, then use the adult and adolescent data to design trials for children. If we look at the slide here, we see 3 studies for those with FOP who are for 18 and older. One for 14, the PIV1 trial with palovarotene. The age was chosen as a direct result of a previous study, so the first step was already taken. IPN 60130 lists children as young as 5 as eligible to enter the trial. However, inclusion will only occur after the adults and older children have taken the drug, and the data has been submitted to regulatory agencies such as the European Medicines Agency and the United States FDA for approval to enroll younger children. What to expect in a trial? Number 1, initial discussions with the principal investigator leading the trial at your site or the study coordinator, sometimes called a research nurse, will help you understand the trial design, what is expected of you, and what investigators hope to learn. 2, screening to determine if you are eligible. A genetic diagnosis may be needed. You may need to be screened to be sure you aren't experiencing other health issues other than FOP, and you may need to be able to undergo a whole body CT scan or other testing. If there's a placebo portion of the study, neither you nor the study coordinator or even the lead investigator will know if you are on drug or placebo. So that's just an important point for you. There will be study visits to monitor how you're doing, which may include blood draws or, as I mentioned, whole body CT scanning. So there are expectations. Questions to ask before enrolling. These are really important. Is there any preliminary data? Has it been tested in patients with FOP? If yes, what was learned? If it's a phase 3 trial, what was learned in phase 2? What is asked of me in terms of time commitment? Will the trial cover the cost of transportation or hotel stays if those are necessary? If there's a placebo, is there a time when everyone gets to take the medication, like a crossover design? What other trials are available in FOP? Because you will be talking to FOP investigators, he or she They may be aware of other trials in FOP, so you may want to explore your options. What else should I have to consider? Can I leave the trial to go to another one? No one can make you stay in a trial. However, it's really important to fully consider whether or not you might drop out before you enroll. Researchers from the trial need full data sets to draw conclusions about whether or not a drug is working. Anything else you want to know? You are empowered to join or to not join a trial. The choice is yours. There are several ways to search for trials. So now that you know the questions to ask, there are several ways to search for trials in FOP. Number one, ask your FOP physician. He or she may be very aware of what's happening. They most likely will be aware. Check the IFOPA website. Clinicaltrials.gov, I know many people are familiar with. The European Union Clinical Trials Register, and the pharmaceutical sponsor. If you hear the specific company is hosting a trial, they will have information on their website. So here's a screenshot of IFOPA's website listing clinical trials. You can go to the site or reach out to any of us on staff. Watch for upgrades to this site section of the website. We're working to make it more user-friendly and informative based upon your feedback. Clinicaltrials.gov is a database of the U.S. National Institutes of Health, which lists clinical trials around the world. Here is a screenshot of clinicaltrials.gov. For those of you familiar with clinicaltrials.gov, it may look a little different than you're used to seeing. The website is currently undergoing an upgrade and now includes filters for you to see what is in your local area. If you know a little bit about the trial, like an acronym or the name of a company, you can search that way too. For clinicaltrials.gov, when you click on a particular study, you'll be able to learn more by reviewing the study overview, who to contact by phone or email to learn more, enroll, or both. Contact information is always listed if a trial is enrolling. Another useful site is the European Union Clinical Trials Register. It has a search bar circled here in the middle of the page in red. If you put FOP into the search bar, you'll find a number of trials, including those that are enrolling, as well as those that have ended, even if they've ended more than a year ago. This is also true for clinicaltrials.gov. History is not removed from these listings, so you can see what's happened before. When you click on a study record in the EU Clinical Trials Register, you can see. Let's see if that's. Yep. Okay, circled in red here. Sorry about this. When you click on a study record, it may not be clear from here. Often the information listed in EU Clinical Trials Register is much more extensive than what you will find in IFOPA's website or clinicaltrials.gov. So what's circled here are additional links, and you'll be able to find more information there just in general. So it's good to keep this in mind. So I want to thank you for giving me the opportunity to speak today. And if there's anything I can do for you, please reach out to me. So my information is listed on the upper left corner. And we have additional resources for you on the IFOPA website. We've created an interactive glossary that uses a lot of terms that you'll become familiar with as you search through clinical trials. We've added a frequently asked questions section as well. And we have some videos explaining clinical trials in general. So we're happy to walk you through those, share that with you, or answer any question you have. Thank you, and have a great family gathering.
Where are you trying to go?
I just need to see. Okay, wonderful. Well, thank you. I think we've given you a wealth of information. I mean, you've heard everything about the registry to the biobank to clinical studies and trials to other real world evidence surveys and patient advisory board opportunities. So we've given you a lot of things to think about. So if you have questions, please go ahead and post your questions in the Q&A. We did have a question, Dr. Perrin, about the biobank. And the question is, you mentioned that we need samples from people that are experiencing flares. So how do you define a flare? At what point, is it once the flare is started, is it too late? How do I know if I'm a patient experiencing a flare? When is the right time to reach out?
That's a great question. Um, all we can do right now at this point is define a flare by when you think you're having one. We don't have that test to tell us exactly what constitutes a flare. And as far as what time, any time is a great time to reach out to us and donate. We'll take samples from when you're not having a flare, from the time that you first think that you're having a flare, or to when you're in the middle of it and you absolutely know, and even toward the tail end. We want to see changes across that whole timeline to help us define everything that's happening. So anytime, especially anytime you think you're having a flare.
Okay, very good. Okay, I'll check the chat and see if we have other questions. Sammy, can you cover again about how long it takes that initial enrollment survey? There was a question about how long it takes to do that, and can I start it and then leave and then finish it a different day if it takes a while?
Yeah, of course. So the first survey is the enrollment survey, and that does take about 60 minutes of your time, 30 to 60 minutes. And a large part of that is because you also have to do the account creation process as well, and fill out the informed consent form. So once you've completed that, you'll just go through the normal surveys, and that will take maybe an additional 30 minutes. We do ask additional questions that are kind of one-time questions. So those are about your history with FOP, and we also ask for your FOP diagnosis report as well. So, and to answer your question about stopping and starting, you can definitely do that as well. Anytime you leave the page, you can always come back and it'll pick up where you last left off.
Okay. And then how do I know when it's time to fill out that next survey?
Yeah, so once you complete your enrollment survey, that kind of starts the clock. And every 6 months, you'll receive email reminders and text reminders if you opt into those when you're creating your account to that your survey is coming up. And you'll continue to get those, I think, on a weekly basis until you complete your survey.
And how long, when I get that reminder by email about the follow-up survey, how long does a person have to complete it?
The window is typically 30 days. So, but we do extend that by a little bit depending on circumstances. So if you do miss your survey, you can always reach out to me and we can evaluate it just based on, how late it might be.
Okay. And then one other question is, if I've missed maybe my 12-month survey, is it okay for me to jump back in at the 18-month survey and fill that survey out next?
Yep, absolutely. So once you do submit your enrollment survey, that clock will continue running, even if you miss a survey. So if you do miss that 12-month, you'll start to receive those reminders for your 18 months.
Okay, that's great. Dr. Shao, this morning at the FOP treaters panel of commonly asked questions, Dr. Al-Muqaddam Mona was sharing information about the incidence of fibroids that we were able to find in the registry. Are there other key areas of information that the Medical Advisory Board and the Publications Committee are looking at in the registry that will be important information?
Absolutely. I think as we get a better sense of what is going on in FOP, we get additional questions. And so the fibroids, as well as onset of puberty and growth patterns, those are aspects that we would really like to know more about, partly because it helps drive some of the design of clinical trials, but also because I think a lot of this information is really important as we start to see potential new aspects that we never really understood about the FOP disease process before. So I think you'll see a number of those different types of forms and a number of those different types of studies get pushed out through the registry over time. And we hope that people will participate in that.
Yeah. I'm just thinking about that from the IFOPA's point. It might be a good idea for us to share information with the community about what the new fields are that have been added, just as a reminder that people could begin to see, okay, oh, I have an opportunity to put new information. I think when I heard this morning the incidence of fibroids, that was the first time I had, really heard that information coming out. So it's great to see the patient reported data like coming to life and being used.
And I think along those lines, that is driven by people telling us what's been going on. And then we put in a form into the registry to systematically try to collect that. And once we get that information, we're able to better say, yes, maybe fibroids are actually part of the FOP spectrum, and that we should be aware of this and making sure that those types of things are monitored for.
Yeah, absolutely. And it's even things like, here at the IFOPA, we see the conversation. We have conversations with families, but we see the conversations that are happening, in support for FOP or on social media, or we receive emails or have phone calls. One of the things we noticed was, a lot of people talk about fractures. And so we know that now that is a question that's being asked in the registry as we're collecting data on fractures now. So I think it's just, you might think you're having an innocent conversation on social media, describing what's happened to you, but it's all important patient-reported information that we're looking for ways to turn it into scientific data. So again, we always respect your privacy, and none of that is ever shared, but your conversations are insightful in helping us ask better questions about the experience of living with FOP. Oh, yeah. I think Danielle did a great job of kind of going over some of the resources. One thing I do want to mention is that there is an exhibit booth called Clinical Studies and Trials. And in that exhibit booth, there are a variety of resources, some of the videos that you've watched today, but there is also a resource that was put together by PRA Health Sciences. They help support pharmaceutical companies and academic researchers in clinical trials. And they put together a decision-making guide for participating in a clinical trial. So it has, Danielle gave you a sprinkling of the questions that you might want to ask, but there's a full list of questions you might ask and things that you might consider, especially when you're choosing between multiple trials. So if you haven't had a chance, please stop by that Clinical Studies and Trials booth and download that tool. It's really helpful as you think about the different choices that are available to you. Let's see here. For Dan, just a question. If you can remind us, when should a parent who has children that are in that they could lose a tooth age range. I'm not sure what that, like maybe it's a wiggly tooth or maybe you're like just in the range. When should parents reach out to you to get a toolkit?
Yeah, if you're interested in donating your child's teeth, please reach out to us at any time. What we want to do is just get you into the system, get you through that initial bit of paperwork. And then once that's done and we know that your child is going to be a tooth donor, all you have to do is email us and send us a quick email whenever the tooth becomes wiggly. And then we can send out a kit within a couple of days. You'll stick that in your refrigerator. When the tooth falls out, you'll drop the tooth in and mail it right back to us. If you haven't done it yet, then just as soon as that tooth becomes wiggly, go ahead and go to the biobank and start filling out that information. And if a tooth falls out and you haven't done it yet, drop the tooth in some milk, stick that in your refrigerator, and send us an email, fill out the information as quick as you can, and we'll get a kit out to you, and hopefully, or we'll give you the address to send that to the University of Pennsylvania, where they can try to process that tooth anyway. So earlier the better. Get the paperwork out of the way, but up until the point that the tooth falls out, you can contact us.
And we have had this question before. If it's already fallen out, and it's been under the pillow, the tooth fairy has collected it, and now it's like in my drawer.
Yeah.
Thinking, what am I ever going to do with these teeth? Unfortunately, those teeth at this point are no good.
No, we're actually trying to get live cells out of the teeth. So, you have to forego the tooth fairy, unfortunately. The tooth fairy doesn't get to collect the tooth. It has to go to the FOP tooth fairy. So
these parents are going to be raising socially responsible kids that
absolutely.
Are giving up the tooth fairy money in order to help advance science. So I love it. So, okay. Well, I'm looking, I don't think we have any other questions. I think the last thing I'll just mention is Sammy talked a little bit about the work the IFOPA does and what we call real world evidence. And that's patients, like we have the data you give us in the registry, like the numbers, I've had this many flares, it lasted this long. But we also want to hear your story, like your tangible story about what it's like to live with FOP. So there are times when the IFOPA may send out a message or post something in a newsletter that we are putting together a patient advisory board where we may be doing some focus groups, or we have a survey for you to take. Those are all importantly valuable as academic researchers think about FOP, as clinicians think about how to treat it, and as pharmaceutical companies think about how to develop drugs. So I think, please be watching for those opportunities. Some of them, sometimes those are paid opportunities, sometimes they're not. It just kind of depends on how it's been set up. But those, if you're not signed up for the newsletter, you won't get those announcements. So it's ifopa.org/connect. Or if in the registry, you'll also get the announcements about those opportunities. And then I think the last point I just wanted to make on Sammy's slides were that, we said we're also helping regulators understand the importance of FOP, and there is a critical opportunity to do that. So when we say regulators, we mean the government organizations that monitor drug development and drug approval. So as you hopefully know by now, on October 31st, the U.S. Food and Drug Administration is reviewing the first new drug application for a drug to treat FOP, and that is palovarotene capsules. On the 31st, there will be a day when the FDA meets. They have representatives from Ipsen that talk about the data and explain the data about why the drug should be approved. And then there are people from the FDA who've reviewed the data that kind of share their thoughts about the data. But then there's an important part of the day where they're considering what the voice of the patient says and what it's like to live with FOP. And you can contribute to that piece of the day. So there is an opportunity that you'll find on our website where you can write a letter to the FDA and talk to them about the experience of living with FOP. Generally, it's best to keep your letter to one page. You can include a few pictures. The letter should be in English because the people that are on this US FDA committee generally speak English. They may speak another language, but the letter should come in English. And so we're glad to share with you that this is a special opportunity. We're not asking you in this to talk about whether or not you think palovarotene should be approved. That's not the point of this. The point of this is to let regulators know what it's like to live with FOP and about the debilitating progression of the disease. And only you can tell them that. You are able to tell those stories. So we hope that you'll consider writing a letter. We actually hope that the deadline is October 17th. So it is a week from tomorrow. So you've got a week to write your letters. They are submitted electronically. So when you go to our website, if you go to the main page of our website, you'll find the link. It will tell you exactly where to go to submit your letter electronically, your photos electronically. But it's an important step for the FDA to learn more about what it's like to live with FOP. We held a rare disease patient listening session at the FDA in 2019, but this is now in the new drug application stage. So people are aware about FOP, but this is really the time for us to share what the experience of living with FOP is like. So we hope you'll take advantage of that. There is a booth today at the family gathering that you can visit, and you can click the link and find the page with more information. So if you have any questions about that process, email us at together@ifopa.org. But we hope that every person living with FOP, caregiver, sibling, parent, you're all welcome to talk about the experience. So thank you so much, Dr. Shao, Dr. Perrin, Sammy. You are bringing the voice of the patient and the experience of the patients and what they're contributing to research alive. So thank you for doing that.